Okay, so I'm going to do a newborn assessment, and this is a baby boy. So what we're going to do is the APGAR score, which is taken about 1 minute and also 5 minutes after birth. So we're going to assess the appearance, the pulse, the grimace, activity, and respirations. So I see here that he is completely pink. So skin is good. So we're going to give him a 2. We're going to check for the pulse. And we're going to be doing this for a minute. And it's going to be over 100 beats per minute. So he has about 110. So he gets a score of 2. Anything less than 100 would be 1 point, and then absent would be 0. For the grimace is 0 would be no response. A little bit of grimace would be 1, and then a strong cry would be 2. So we'll give him a 1. And for activity, it looks like he's pretty active, so that's a 2. And not really doing much would be a 0, and then some would be a 1. Respirations, it looks like he's regular. Respirations at a normal rate would be 30 to 60 beats per minute. He's at 40. That means he gets a 2. Anything slow, irregular, we'll give him a 1. And then any absent would be a 0. So based on this, we'll be giving him a 2, 4, 6, 8, 9, a score of 9. So anything 7 to 10 would be normal, and anything 4 to 6 would be moderate. He might need some oxygen or some of that sort. And then 0 to 3 would be severe. And also part of the newborn assessment, not only do we assess the skin, respiration, pulse, and all that, and also the vernix, the hair. We want to look in the skull to see if there's any bleeding, anything that doesn't look okay. We're going to check the ears, the breast tissue, genitalia. So we're going to assess, since this is a baby boy, we're going to use 3 fingers, and we're going to palpate each of the testicles. Okay, it looks good. And then also palpate the other one. Okay, we're going to look at the soul creases. Everything looks good. We're going to see if the baby can suck. Okay, check the nose. Okay. And part of this, we also look at the umbilical cord, and we're going to tell the mom, or the dad, the parents, that do not soak any of the umbilical cord. Let it fall off. So make sure that when they put a diaper, you fold the diaper. And we also look at fractures. We're gonna also give the newborn the vitamin K. Let me get a pen here. And the vitamin K, it prevents bleeding. And so newborns don't really make vitamin K. They do not have the bacteria. And it's going to be placed in the vastus lateralis muscle. So we can't really fold it here, but we're going to go ahead and inject them. Okay, and we also going to give them the erythromycin eye drop, and eye ointment, and that's to prevent any eye infection. Okay, from the inner to the outer, and the inner to the outer. Okay, we're gonna give we're gonna get like a little tissue and another tissue for the other eye. We're gonna go ahead and turn them around in the prone position, and we're gonna make sure that everything looks good. You're gonna look at their back, and in this case, we would look at any abnormalities, the head sutures, and also the anus to make sure that everything is good. We're gonna look at if there's any drainage, any dimple, and like any spinal defects. And if so, we're gonna go ahead and call the provider. Okay. So this completes an assessment for a boy. So that's for a boy, and we're gonna go ahead and do a girl, and same thing. Their head, their hair, ears, nose, mouth, make sure they suck. The palms of the hands to make sure the color, skin. Okay, we're gonna look at the area here. Make sure everything looks good. Same thing, umbilical cord. Make sure they don't clean it off, or make sure it's maintained dry. Okay, and this baby girl also is pink, so we're gonna give her a 2. And the pulse, we're gonna say it's a 98, so we're gonna give her a 1 on that. Grimace, she's got a strong cry, so we're gonna give her a 2. Activity, not as active, so we're gonna give her a 1. And respirations, we're gonna go ahead and give her that she's 45, so she's good on the respiration. So that's 2, 3, 4, 5, 6, 7. So 7. So she still falls in the normal range. And same thing, we're going to be doing the assessment, checking for the skin, the vernix, the hair, the ears, breast tissue, genitalia that we did, and the sole creases. We're going to be putting her in her prone, and same thing, look at the sutures, look for any abnormalities in terms of looking in their back, any fractures, the molding, and the symmetry with the crease. We're going to be extending arms. Sometimes when it's not even, that could mean there's hip abnormalities, so we want to make sure that we also check that. And same thing, we're going to give her the vitamin K shot in the vastus lateralis muscle and the thigh right there, and also the ointment, inner tooth out. We're gonna clean her out, in and out, clean her out. Okay, and that completes the assessment of the newborn baby girl. Thank you.